last time on Let's Play Trauma Team, we discovered that our patient has not only a condition that seems to mirror Kaposi sarcoma, but the tumors on her skin have spread so quickly that they have infested her intestines. So we need to check her other organs to make sure that they don't spread any farther than they have, or if they have, we can identify her true condition and get it treated. Whatever she has, it's really serious.
Doctor, how is it? What am I ill with?
I can't say for certain yet. Sorry, but I need to run more tests.
I understand. I have faith in you, Doctor. There's something I need to tell you.
Is it a new symptom?
Well, yes. Seriously, this cold season's been really tough recently, hasn't it?
Okay, what do you have to say?
I don't know why, but my chest's been hurting for a while.
Now you have chest pain?
Chest pains, huh? She looks like she's in a lot of pain. Roni, could you make a note of this?
Understood, Doctor.
So she's got stomach pain, chest pain. Well, I guess at least she doesn't have back pain.
If this keeps up...
You okay?
She seems to be coughing a lot. Could it be her lungs or bronchi? Roni, let's record this too.
Understood, Doctor. New symptom observed. Coughing.
I'm sorry. Anyway, I won't be able to work if this continues. I won't have to be hospitalized, will I, Doctor? I'd have to rearrange my schedule.
Alright, let's take a look around. See if we can find anything new in your lungs. That's normal. Where'd the bowel sounds go? Okay, so nothing there. Let's look at the EKG. I don't see anything wrong with the EKG. No. Okay.
Doctor.
You okay?
Are you alright? If you're not feeling well, we do have beds ready.
Oh, no. It just seems like the chest pains are getting worse.
Her symptoms are getting worse. We need to redo all the exams.
Understood, Doctor.
Oh,
I'll
my
make the
goodness.
Sorry to keep you waiting when you're...
I know.
I understand.
Okay, what's going on now?
When I was coughing just now, I tasted blood.
Wait, you're coughing up blood?
Tasted blood. This isn't good. Roni, add bloody sputum to the list.
Understood, Doctor. New symptom observed. Bloody sputum.
I can't believe this. I had the kidney transplant. My life was going well. Doctor, it's getting hard to breathe. Could this be related?
Dyspnea, too?
She's suffering from a mild case of dyspnea. Roni, you got that one?
Understood, Doctor.
What the hell is
New
wrong with
symptom
this girl?
observed. Dyspnea.
Okay. EKG looks fine. Nothing there. Maybe, is there something I missed? Maybe I'll get a hint at what I'm looking for here if I go and look at the symptoms. Or not. Okay, what am I missing?
Sorry to keep you waiting.
I know.
I understand.
Is that everything? Let's just double check her consultation, make sure.
I had the kidney transplant, Doctor.
No. What could it possibly be? Oh, her lung.
These respiratory sounds are weak. What about in other areas? As I thought, the other areas are normal. They're only weak in the lower left lung. It's some form of lung abnormality, for sure. Roni, get approval for an X-ray exam. We need it done right away.
Understood, Doctor. The X-ray exam is now available. New symptom observed. Attenuation of respiratory sounds.
So she has one lung that's working and one lung that's not. Huh. Alright, let's take a look at those images now.
Doctor, the patient's X-ray images are ready for viewing.
Sounds good. Let's see them.
Just one image, okay. Oh wow, like, is half her lung missing or something? Not low enough, am I?
A white shadow in the lower part of the left lung. It's definitely a sign of fluid accumulating in the thorax. So we know she has a lung abnormality, Roni. Let's narrow down the candidates.
Understood, Doctor. New symptom observed. Pleural effusion.
That's probably where the chest pain is coming from if she's got a bunch of fluid in her lung.
Doctor, would you like to narrow down the diagnosis candidates?
Of course. That's why I came here, right?
Alright, what could this be? Fever, coffee. We don't have discontinuous sounds, so it's not that. Could be this. chest pain, dyspnea, coughing. Respiratory attenuation. Oh.
It's throwing me off my pace.
Or not. Bloody sputum, dyspnea, coughing, pleural effusion. This is the one. We didn't do a blood analysis. And there was a symptom, so it is... So it is this one. Chest pain, coughing, bloody sputum, dyspnea, respiratory attenuation, pleural effusion.
Carcinomatous pleuritis. All her symptoms apply to it. We'll need a CT scan to confirm the diagnosis, though. Roni, how's our patient doing?
She's not doing well, Doctor. Please return to the examination room immediately.
Uh-oh.
All right, let's go check on her.
What's wrong with her now? Oh, that's severe.
My chest. It really hurts bad now, Doctor.
Her condition's worsened even further. We can't continue on with the diagnosis. Roni, request a room immediately. She needs to be hospitalized and her symptoms need to be treated.
Doctor? No. I can't just let the symptoms be treated. Can you please continue examining me?
That's dangerous.
Huh? Do you know how much of a risk you're in right now?
I finally thought that I could live. I had a new kidney. I recovered from the operation. I could finally live a life on my own. So please, Doctor, please find out what's wrong with me. Please cure me.
Roni, cancel that hospitalization order. Let's finish the diagnosis.
With all due respect, Dr. Cunningham,
What? You always rant about how I need approval from the patient when it comes to performing exams, but you won't listen to the patient when it comes to hospitalization and diagnosis? When things are inconvenient, we should push all the responsibility onto the patient? Spend all day worrying about how to avoid a lawsuit? To hell with that!
understood. I admit even I find incongruities with the protocol that I have been designed to conform to. I think I shall add, to hell with that, into my computer registry.
My thoughts exactly. Right. So it's X-ray time again. And order a CT scan as well.
Understood, Doctor. The CT examination is now available.
Alright, we gotta take a look at these images right now.
Doctor, the X-ray and CT exam images are ready for you.
Put them on the display. I want to see what's going on.
7 images, holy crap. Well, we already confirmed that one. Yeah, I'm just probably gonna have to take a look at all these images myself. But I'll just show them all to you. Maybe I can find something my first time through, who knows. If you need to look at them, just slow the video down and pause it. You'll find them. Yeah, I wasn't able to find any at first glance, so I am going to take a moment to capture these images, look at them, and be right back. Alright, now one thing you will have to remember is that this difference here, you already You already found this symptom in a previous exam, so you can't count this one. However, there is something very interesting in the X-ray image right here. This is definitely not normal.
Huh? What the hell is this? Hey, Roni. This shadowing.
I anticipate this is a new symptom, as it was not confirmed by the previous X-ray.
Then this had to have happened within, like, the last few hours.
New symptom? Don't be ridiculous. I've never heard of anything like this suddenly popping up inside someone. Roni, collate the data and check what it is.
Yes, Doctor. One moment, please. There is no matching data. It is an unconfirmed symptom.
No matches?
Damn it. What's going on?
What in the
There is
world?
less than 1% probability of ascertaining what it is from the data at hand. I recommend that you remember the shadowing for later and continue with the diagnosis.
Yeah, you're right. I can't spend any more time on this. Roni, let's continue with the diagnosis.
Okay, now the other difference is right here. This one's actually really tricky to spot if you just use the in-game and don't extract the images. Right up here, there's a tumor shadow.
Found something. Tumor shadows. Roni, make a note.
Understood, Doctor. New symptom observed. Tumor shadows on lungs.
I think that'll about wrap it up.
Alright. I think I have enough to make a diagnosis. Let's get back to the office. Still, what in the world is that shadowing?
That shadowing is just... That's crazy.
We should have all the symptoms now. Roni, I'm gonna make a call on the diagnosis.
Understood, Doctor. Displaying the diagnosis candidates.
Well, I think that's it.
There's no mistake that it's carcinomatous pleuritis. But I'm not convinced. Skin to the small intestine. Small intestine to the lungs?
Where else is this thing gonna
How
go?
can a focus that devours the human body at such a rate exist?
Doctor,
Oh, sorry. What is it?
no further progress can be expected at this point. The diagnosis will be completed temporarily. I will leave the cause of the disease as unknown and call attention to this case.
Yeah, they've got no other choice.
Wow.
I'm stumped. What am I supposed to tell her?
I couldn't imagine, like, being a patient, and then the doctor says, we have no idea what's wrong with you.
Dr. Cunningham. Ending the diagnosis.
That would be really scary. From both the patient's perspective
Doctor,
and the doctor's.
Are you alright? Is something wrong? Please, you can say it. What's wrong with me?
I'm sorry, but I can't say anything for sure yet. Please be patient. I want to keep you hospitalized a bit.
That's fine, Doctor. I'll put myself in your hands.
I'm sorry. I promise I'll do everything in my power.
Both as a doctor
Hey,
and a
Roni.
patient, it's gotta be scary.
Do you need my assistance, Dr. Cunningham?
Another little trick of yours, huh? Sounds useful.
I can utilize this facility's entire installation network.
Huh. All right. So, what do you think about that patient?
I found no reasonable matches within the current literature. I suspect it is an unidentified condition.
Well, for once, I agree with you. It mirrors Kaposi's sarcoma, but it spreads much faster.
I estimate the entire lung will be affected within 20 days.
20 days?
We don't have time to sit and think. We need to treat the skin, lungs, and small intestine all at once.
An operation like this would yield a 10% success rate.
Not if Derek Stiles did it.
There's no other options, though. I'm stumped.
Should I request a hospice transfer and notify her family?
The earth was blue, but there was no God. We did all we could. Now, we just have to hope for the best.
One thing I've learned over the years, never give up.
I'll be assisting. A specialist's coming in for it.
That's it! Roni, you said you have access to the full facility, right?
I did, Doctor.
All right. I want you to look up OLCVR data. Records, footage, surgeon name, contact info, everything. I promised I'd do everything in my power. Well, I guess I gotta follow through with that.
Wow, are we actually going to go in and treat an unknown
to the Focus
disease?
Forceps 2. Hurry.
Isn't the boy just superb? Now are you glad he's here?
Yeah, thanks to you. I'm in your debt, I guess.
You threaten me so you can use him, then you thank me.
Hey, no threats. I just asked you to lend him to me.
Of course not. Still, I have to say, it takes guts asking for such a big favor to save your patient. Well, son, I guess you and I are square now.
To save a patient, huh? That's nothing noble like that.
Well, that was pretty exciting. I wonder when we're going to treat this guy. And it looks like we are not going to have another Gabe diagnosis for a while. It doesn't look like we're going to have one for another 8 episodes. Yeah, matter of fact, according to my episode list, this guy that we just diagnosed, or this girl rather, we're going to treat her next episode. See you later.